Johnny, who's sitting next to you. They keep us on our toes, basically. On behalf of the board, I would like to extend our thanks and acknowledge leadership at our Manhattan facilities. Is Mr. LeConte here? George. Yeah. Oh, George is from Harlan Hospital. From Metropolitan is Miss Cristina Contreras. And from the home here at Bellevue is William Hicks. And from our Carter Hospital, which is long-term care and nursing home as well, a unique model is Mr. Floyd Long. And he's also from, did I say Metropolitan? No.
You got Metropolitan.
Yeah. Floyd is from Carter, which is like a two-sided dual wonderful facility who has done remarkable things for families. And then we have Stefan Catullo from Kohler. Stefan? Okay. And Susan Sales from Gouverneur. That's a skilled nursing facility. And the dedicated staff who's joined us here also this evening. I'd like to thank them for their exemplary services to our public health system and the people we serve. I'm sure that we all have seen the transition over the years, and we're real proud. We're a proud group. Thank you all. And to you all, I'd like to extend our support as we strive to provide equal access to safe, affordable, quality care to all. Now, I will turn over the microphone to our President and CEO, Dr. Katz.
Thank you. And Barbara didn't mention not only a nurse, but a nurse at New York City Health and Hospitals for many years as the chief nursing officer at Woodhull, among other roles. I'm Dr. Mitch Katz. I'm a primary care doctor and the president and CEO of New York City Health and Hospitals. This is my 7th year at the health system, and I'm proud to lead a institution that has such an incredible mission and so many amazing people. I appreciate the board members who came and our staff member who came, and I'm particularly looking forward to hearing the comments from the public. I want to go over a few of the highlights from the last year. We opened up a new hospital, first new hospital in New York City in many years, the Ruth Bader Ginsburg Hospital on the campus of South Brooklyn Health. We were able to honor our nurses with a good contract that enables them to gain pay parity with other hospitals. We remain at the forefront of the city's response to the asylum seekers, providing shelter, healthcare, caseworker, social services, and here at Bellevue, a lot of deliveries, a lot of happy deliveries. Correctional Health opened the first ever reentry service center on Rikers. We have a lifestyle medicine program which began at Bellevue and is now available in every borough, including New York City Health and Hospitals Elmhurst. All of our hospitals began serving plant-based meals as the primary choice for dinner. And I would say in the last year when I was a patient here, those meals were excellent. And I had a food service fellow who came in every day and told me what his favorite choices were and made me feel better. New York City Care hit a milestone of 125,000 members. We've housed 500 people into permanent housing through Housing for Health. Ms. Lowe mentioned it, but Newsweek once again ranked Seaview as the #1 nursing home in New York State, and 3 of our other skilled nursing facilities ranked in the top 10, and 5th was ranked in the top 30. So this is all in a state with 600 nursing homes, proof of how the public sector can be the very best. We opened up a new extended care unit at Kings County. We broke ground on a new housing development at Woodhall campus that will have 93 apartments. We distributed $1 million in debt relief to 27 behavioral health providers in exchange for a 3-year commitment to serving our patients. We launched the first public telehealth medicine abortion services through our virtual express care. We were recognized by the American Heart Association, the American Medical Association for our excellent care. We expanded our services for survivors of intimate partner violence. We expanded our use of robots, and we launched a multi-year project with Children's Services to improve referral pathways for children to prevent child abuse and offer treatment as well. And then within the borough of Manhattan, Bellevue received accreditation as an academic comprehensive care center. Bellevue's dermatology team opened a new Mohs micrographic surgery lab for the treatment of skin cancer. Bellevue's palliative care program opened up a new Serenity unit. The Pride Health Center has been selected as awardee of the 2024 LGBTQ Health Workforce Conference. In terms of our other great facilities, 2 doctors from New York City Health and Hospitals Harlem were named to the list of 2024 top Black doctors. Harlem's Burn Intensive Care Unit received the Silver Level Beacon Award. The Association of Perioperative Registered Nurses honored Harlem for surgical safety, and Harlem also received the stroke certification for the Joint Commission. Over just uptown at Metropolitan, we've designated Metropolitan as our system's official rehab center, and we want to really work to build that. Rehab is an incredibly important service that we provide, and we think having it all be at Metropolitan is going to make it that much better. Metropolitan was redesignated as a baby-friendly hospital. It was also recognized as a National Safe Sleep Hospital, received the Gold Beacon Award from the American Association of Critical Nurses. And then in terms of Gotham, the Manhattan sites continue to have a high number of patients. And the Gotham's Gouverneur and Sydenham sites both received awards for their target to a good blood pressure and targeting to good diabetic control. So these are just a small number. We would never get to your testimony if I spent all of the time talking about all the amazing things that happen at Health and Hospitals. I'm incredibly proud of the people who work here, and I look forward to your public testimony. And with that, I'm going to turn the mic to our General Counsel, Andy Cohen, who will explain how the rest of the hearing will proceed.
Great. Thank you so much, Dr. Katz. So this is the second in a series of 5 meetings that we conduct annually across the city's 5 boroughs. The purpose of these annual meetings, and this is obviously the annual meeting for Manhattan, is to inform the public on the programs and plans of New York City Health and Hospitals, as Dr. Katz just did, and as well as to give the public an opportunity to give oral and to submit written testimony concerning NYC Health and Hospitals performance and programs. All of the testimony that we hear tonight and anything that we receive, anything that we hear and anything that we receive in writing will be transcribed and forwarded to all the members of the Health and Hospitals Board of Directors for their consideration. But of course, here live to hear your comments live are a wonderful selection of our board members as well. We've just hit the end of the registration period for speakers. So I bet if anybody in the room hasn't registered yet, the window is basically closed at this point. And just to give you a flavor, we have about 15, approximately 15 speakers this evening. So I'm going to moderate and call on the speakers for the balance of tonight's meeting. And I'm just going to give you a minute on the rules and the format for the rest of the night. So most important thing is that this is an opportunity for for the members of our board to listen to you. This is not a dialogue and not a Q&A session, but speakers will be given an opportunity to speak, and our board members are here to listen, and other board members will get a transcription. Registered speakers are given 5 minutes of speaking time. You can see here on this podium, on this corner of the table, hopefully you can see, but you certainly can see from the microphone over there, is a timer that will give you a warning about the expiration of your time. It will be green when you first begin to speak. It's green for 3 minutes. When it turns yellow, you have 2 more minutes left in your time. When it turns red, you've hit the end of your time, and it'll start blinking. And at that point, I will gently interrupt you and ask you to please finish your sentence and submit anything else that you haven't had a chance to say, if anything, in writing. And I promise you, it will be read. And any written remarks that either supplement or are a copy of what your oral remarks are should be given to Calicia Hercules, our board corporation secretary to my right. I will, it's a small room, but I think I'll still do it. I will call speakers by name. Please come up to the microphone here. I am giving the affiliation that you've provided when you registered. I will also give the name of the next person who's up to speak so that you know that you are in the
Queue.
on deck and on the queue, whatever, as you know what I mean. So with that, we're going to move into our list of speakers and get started. So our first speaker is Morgan Simcoe, who is representing New York State Senator Brian Kavanaugh from District 27. Is Morgan Simcoe here? And after Morgan will be Peyton Schulteis, who I'll introduce next. Thanks much.
Hi, everyone. Thank you so much for being here and giving us the opportunity to speak. I just wanted to briefly say hello. My name is Morgan Simcoe. I'm the Chief of Staff for Senator Brian Kavanaugh. He represents Lower Manhattan, which is most of 14th Street and below. So while your physical facility is not in our district, certainly a lot of our constituents go to your facility. So I'll mostly be listening. And probably the most prevalent topic that we have been working on that certainly intersects with the work that you're doing is the closure of Mount Sinai Beth Israel. So while that's not an H&H hospital, certainly interested to hear what residents are concerned about and just trying to think of the big picture and meet the gaps there. So thank you very much.
Great. Thanks so much for your comments. Next speaker is Peyton Schulteis, who is representing New York State Senator Kristen Gonzalez from District 59. And the speaker after that is Michael Smook.
Hi, my name is Peyton Schulteis. Like you said, I'm a community liaison for State Senator Kristen Gonzalez. State Senator Kristen Gonzalez's district does include Bellevue Hospital, where we're here tonight. Her district also includes the neighboring hospital, Mount Sinai Beth Israel, as Morgan mentioned previously. With Mount Sinai Beth Israel seeking closure, we understand that many patients who would be treated at MSBI will be sent to Bellevue instead should this hospital closure go through. From everything the Senator's office has heard, such an increase in patients could be overwhelming to Bellevue. While Senator Gonzalez is committed to fighting to prevent MSBI's closure, she recognizes that regardless of the ultimate outcome, this closure attempt has already impacted neighboring hospitals such as Bellevue and patient care in the area. The Senator does not want to see Bellevue overwhelmed by a number of patients it doesn't have the capacity to accommodate, especially since our public hospitals are often where the most vulnerable New Yorkers go to seek care. Regardless of the outcome of the fight to stop MSBI's closure, Senator Gonzalez is committed to fighting to ensure that Bellevue gets the funding and resources it needs to continue serving its patients. Thank you.
Thank you so much for your comments. If you wouldn't mind, are you Michael Smook? Actually, there is There is a speaker who is actually on a shift right now as a resident. So I wanted to give Nicholas Frazette an opportunity to speak now so that you can get back to work. Thanks. So Nicholas Frazette, a resident physician and a CIR, that's a Committee on Interns and Residents union member. Go ahead.
Yeah, thank you. And I very much appreciate the opportunity to speak quickly. As I was introduced, my name is Dr. Nicholas Frazette. I'm a resident physician here at Bellevue Hospital. I'm a member of CIR, our residents union. I'm also an H&H patient at King's Hospital and a proud New Yorker. So this hospital system really means a lot to me. I just wanted the opportunity to speak to the board. As I'm sure you're aware, we're currently in contract negotiations with City Hall regarding our salary, our benefits for the upcoming several years. As you might not be aware, we're concerned about the city's offer. The city's current offer is going to leave H&H residents as the lowest paid residents across New York City. And when I say that relative to our peers, I don't mean relative to NYU or Presbyterian or Sinai, but relative to other safety net hospitals across New York that serve the same patient populations that H&H does. This is something that is really critical to my heart. Not only am I a resident physician here at Bellevue, but I was fortunate enough to go to medical school at NYU, where Bellevue is our primary teaching hospital. And so I've been familiar with this hospital for quite a long time for its mission of serving any New Yorker, any person who walks through its doors, regardless of their background, their ability to pay, their documentation status, anything like that. I believe in this mission, and it's my honor, it's my privilege to serve the New Yorkers like myself and the folks behind me. With the contract that the city is offering, it stretches us quite thin. I commute over an hour to be able to afford a place to live. And even then, I'm still budgeting for commuting and groceries to work on the salary that I do to serve the New Yorkers that I do. As someone who's been affiliated with Bellevue for 6 years now, I think about the next 6 years and the next 6 years after that. And where I really get particularly concerned is recruiting new residents to come into this institution. Folks who are interested in serving the lowest socioeconomic class in New York City are going to look at other private safety net hospitals and see that they make more money there, that they can live more comfortably there. We're not, I don't think it's any news that New York City is an expensive city to live in. We're facing a cost of living crisis, and recruiting residents to continue to believe in this mission and to carry it forward is going to be difficult, as are retaining fellows and attendings from our graduating resident cohorts. I mean, I know folks who are my senior residents who have been my mentors for years now, and who have said that they simply can't look at offers from H&H to stay here on board as fellowships because they can't afford to. They're in the phases where they're trying to care for families, for loved ones. And it's a challenge that is, we're at our breaking point now. And so I worry at the end of this contract that we're being offered, what that would look like when we get past the breaking point. And so it's really sort of my personal ask, as a resident, as a patient of H&H, and on behalf of my co-residents in the union, to each of you individually to use the influence that you have as board members of this fantastic health institution, this health system, and support us in our negotiation with City Hall and offering us a fair contract that enables us to continue to serve New Yorkers and carry forward this mission that I believe in so deeply, that I'm sure that you will believe in so deeply, something that we can all agree on. It's an honor, truly, and it's a privilege. And it's, as much as it is, it's harder and harder to continue to believe in that honor and privilege when we're stressed the way that we are. So I appreciate the time to speak, and I'd hope that you'd carry that forward and join us and advocate for us as we continue to bargain as best as we can. Thank you.
Thank you very much for your comments. Thank you, Michael Smook, who is chair of the Bellevue Community Advisory Board. Sorry for the order.
Distinguished ladies and gentlemen, please let me share with you a story about my efforts and my thinking as Bellevue Community Advisory Board Chair. On March 5th, I gave a slideshow presentation to the Council of Cab's Community Relations Committee at Health and Hospitals 50 Water Street headquarters. This talk, which covered Bellevue's accomplishments during the year, was given before my fellow cab chairs at many health and hospitals facilities, and listening at the same conference table was Dr. Katz and Jackie, which is very cool that I'm before them today. After my presentation, I was asked about my thoughts on the closure of Mount Sinai's Beth Israel campus at some time in the future. In my response, I gave an answer which was indirect and hopefully at the same time on point. I said that at Bellevue, no patient is ever turned away because of his or her inability to pay. A large percentage of our patients are either Medicaid or self-pay. At Bellevue, as a municipal hospital, every day through our combined efforts, we channel social justice. Next to Bellevue is NYU Langone, which is also a great institution that serves a noble public need. At the same time, NYU Langone has a more robust funding stream because of a larger percentage of its patients possess Medicare and employer-based insurance, which reimburses the hospital better than Medicaid, third-party intermediaries, or self-pay patients' contributions to Bellevue's fiscal well-being. The difference in patient insurer profiles between these two neighboring institutions translates to me that NYU Langone more so aligns with the free market capitalist system. So if you wish to understand the complex, multi-layered American healthcare delivery and financing system, if you compare Bellevue and NYU Langone with a discerning analysis, you will have a better and more nuanced idea of the differences between both institutions. In terms of finances, as presently constituted, health and hospitals in Bellevue need to work harder to remain economically viable while at the same time performing equally as good healthcare to its patients on an ongoing basis. In our pitch as Bellevue Community Advisory Board to state legislatures through correspondences, lobby day, and the legislative breakfast, we continually reminded our elected officials that the need to supplement additional funding to reach out to all residents, including the medically underserved. So at Bellevue, we will continue to provide healthcare second to none. In conclusion, please note that I truly appreciate that every year City Hospital System creates a community needs assessment and an implementation plan. These planning tools endeavor to build on the present effectiveness of the healthcare system while at the same time meeting city residents' additional needs in terms of enhancing the social determinants of an individual's health and productive life. In addition to focusing on healthcare, this document plans on collaborating with a wide variety of public and private partnerships involved in education, housing, job training, nutrition, and other needs. I remain mindful of several factors in my analysis. I know that there is only so much we can do at the municipal level. The City of New York, for example, needs to balance its budget every year, as do our partners through the state of New York. Yet at the same time, the kinds of long-term, methodical, and systematic planning necessary to create a framework for a kinder, gentler world hides in plain sight when posted online through the internet. Regarding my thinking and what I've been feeling, these documents was, for me, an oh my God moment. It is my interpretation that what we are engaged in creating a system which could be expanded outward through other localities in a more robust way, and perhaps through establishing a nationwide federal municipal New Deal. What New York City Health and Hospitals and its member facilities are engaged in channels what Associate U.S. Supreme Court Justice Louis Brandeis was writing about in a dissenting minority opinion 92 years ago. He wrote that a single courageous state and its localities and may of its citizens choose to serve as a laboratory to try novel social and economic experiments. In the spirit of Louis Brandeis, we are presently engaged in tinkering to make the City of New York's system of healthcare delivery a better and more livable place for all its residents. I've concluded my talk. Thank you for your time. It was a pleasure talking to you.
Thank you very much for your comments. The next speaker is Verna Fitzpatrick, Chair of the Kohler Community Advisory Board, and after that will be Joyce Rivers. Verna Fitzpatrick.
Good evening.
Good evening.
This is my first time speaking to the famous people that are in front of me, but I am the new chair of the Community Advisory Board for Kohler Hospital. As you know, we're located on Roosevelt Island. It's a small island, and it's however, it has been my home for over 42 years, and I became involved with Kohler as a board member prior to the pandemic. However, at this time, There are many concerns at Kohler. It's an old building requiring a lot of upkeep and many very important infrastructure and repairs. However, as it relates to the care that Kohler provides, I want you to know, and you probably already know, how well the staff does at Kohler. The staff does an exceptional job providing hands-on care and all the ancillary services that the residents receive. However, in fact, even recently, they've received the Beacon Award for their Memory Care Center unit, which is a wonderful distinction. However, one of the things that I strongly believe, and I know that the staff and the administration of Kohler would concur with, is that staffing, especially nursing staffing, is a key component of making sure that services are provided in a timely and efficient manner. Keep in mind that the care that the residents receive from the staff members is key to their well-being and their quality of life. One of the things that we know is that recently the federal government implemented advanced infection control policies that must be implemented in the facilities. And in order to do that, there's additional staff that will be needed in order to meet those standards. And the health department, the New York State Health Department, will be surveying the facilities and ensuring that those standards are being met. They can only be met with the appropriate staffing components that are needed in the building. They cannot be done with the limited staff that takes very difficult to meet and to fill slots during the different shifts 7 days a week. Additionally, there are many programs that Kohler has implemented to address employee satisfaction. And one of the things that we know is that the employee satisfaction and resident satisfaction reports are very important, correct? I see you shaking your head. However, unfortunately, the employees cannot be satisfied unless they feel that their needs are met within the building. And staffing is always a key component. And also giving the staff the time to take advantage of the perks that the facility is trying to implement. They're trying to implement a quiet time, opportunities for the staff to regroup, for the staff to have a little mental health moment during the course of the day. And guess what? Not only the staff, but the residents confirm that the staff cannot take advantage of those abilities or those services that are being provided because of staffing constraints. So I urge you, and I know that you know, that staffing is key, and that indeed that's where we want dollars to be used and provide the services that are needed. Hands-on care, hands-on care. The residents are number one, number two, and number three. And without the residents, there's no institution, there are no facilities, right? And if you have those residents that you need in order to get reimbursed, you need the staff that provides the care. It's a win-win for everyone if we make sure that we recruit staff. And there are many options for recruiting. We don't have to switch staff from one facility to the next. There are opportunities to grow staff from the bottom down and make sure that they're available and ready to work in your system and elsewhere. Thank you.
Thank you so much for your comments. Next speaker is Joyce Rivers, Chair of the Sydenham Community Advisory Board, and after that is Karen Moore. Go ahead.
Good afternoon. I am Joyce Rivers, Chair of Sydenham Community Advisory Board. On behalf of the board, I want to thank Dr. Mitchell Katz for attending our public annual meeting on Friday, April 5th. Your presence made it all the more special for us, staff and others who attended the event. Thanks again. Our CAB have a wonderful relationship with Senior Vice President Dr. Ted Long and Gotham Health CEO Michelle Lewis. Both have encouraged open communications, and our discussions are always on how we can improve our center and community health. And we are thankful for their open door policy. Our Deputy Director, Yesenia Pabon, is the right person at the right time for Sydenham, and we are very thankful for her community of advocacy, staff engagement, and vision to make Sydenham better. Yesenia, please stand. Thank you. She is here tonight with us. At Sydenham, the Women's Health Services would benefit and be much more improved with the addition of a sonogram machine. This will ensure that we are delivering the state-of-the-art care to our patients rather than sending them to an acute. Each year, we ask for a larger center for Sydenham Health Center. The staff productivity is not only important to us, but our patients deserve better. On December 11, 2022, Ms. Lewis Sydenham Cab, Vice President Everett Persons, and Secretary Carol Smith with H&H Real Estate Team and her executive team had a site tour visit 5 locations. We have been told there are concerns about the different venues, and both our CAB members have indicated to the board and the same concerns. However, we are very much hopeful to continue the process of finding a venue that is centrally located for our patients and close to mass transportation. Our St. Nicholas Health Center and Developmental Evaluation Center, which is a subspecialty Sydenham Pediatrics Department, it provides diagnostic, developmental pediatric evaluations, medical treatment, including psychopharmacological, developmental monitoring, care coordination, case management, advocacy, and support for infants, children, adolescents, and young adults with whom are at increased risk for developmental disabilities. Disorders evaluated include autism spectrum disorder, attention deficit, hyperactivity disorder, behavior and developmental problems complicating pediatric chronic illnesses, and disabling conditions, for example, genetic disorders, prematurity, delayed development, speech, language, and motor skills, cerebral palsy and other motor impairments, genetic and metabolic disorders, fetal alcohol spectrum disorders. This specialty is very much needed in our community. The DEC Center is very much needed in our community, and we believe the center is not patient-centric and needs to be painted on the inside, more attractive for the families that are stressed before they see the provider. We have patients from New Jersey and Staten Island. Mental well-being is important to the community we serve and is an essential foundation for promoting public health and physical well-being. Oh, I know my 5 minutes is just about up. And thanks, Dr. Katz, for your leadership. And to my mentor, Jackie Rowe Adams, the Sydenham Cab is so proud of you. You are so treasured. Thanks for your dedication to us. And now New York City can see what we see. Thank you.
Thank you very much. The next speaker is Karen Moore, Vice Chair of the Bellevue Community Advisory Board. And after that is Violeta Uribe Gomez.
Good evening. Thank you for this opportunity. I'm going to take a slightly different tack. I'm on the Bellevue Advisory Board because of an experience I had at Bellevue that I'd like to describe and tell you what I thought of it. What did you say?
Maybe get a little closer.
My husband was riding his bicycle home from work and got hit by a taxi and was delivered to Bellevue. He was trauma patient number 9 for the day. He and I spent 6 hours in a bay in the ER. It was remarkable. It has been described as organized chaos, and what that means is chaos walks in the door and Bellevue organizes it. So there was medical, surgical, psychiatric, and social service emergencies and other folks in that room. Still, they attended to my husband. They did a number of scans and then sent him upstairs. He had multiple fractures, so we spent a week upstairs as an inpatient. I'm a health educator, and I've been around hospitals and healthcare systems for 30 years, so I can tend to be a tad cynical about the healthcare system. So I was fairly aggressive in terms of making sure that my husband was getting the care, his medication, etc. I was ready to fight. After about 2 hours and interactions with the staff, I realized I didn't have to fight at all. It was a very professional organization from the top to the bottom, vertical, horizontal. It was very impressive. If I had a question, someone asked it. If I said, what are you giving him? What medication are you giving him? They told me. Why? They told me. So they recognized my anxiety and just let it roll over. And so that was very helpful to people in the hospital. Because of that experience, I volunteered for the Community Advisory Board in September. And as you know, the focus of community advisory boards, not only in terms of trying to generate support from the political end of things, but it's also to the community. So our goal on the board is to reach out to different actors and audiences in the community and try to help them see the benefits and the strengths of Bellevue. I was on the community board 6 for 10 years and the Mount Sinai Beth Israel Community Advisory Council for 6. So I'm aware of the players, and we understand that things are going to change in the neighborhood in terms of healthcare. I think Bellevue is well situated to be able to absorb and address the changes. I think it's a resource-constrained environment that does a really professional job very well of providing excellent care. The purpose of the public system is to counteract the depredations of the marketplace, which is for-profit healthcare. I just want to congratulate Bellevue on doing a really wonderful job of supporting that mission. Thank you.
Thank you so much for your comments. Next speaker is Violeta Uribe Gomez, a community relations specialist for Metro Plus Health. And after that is Tashana King.
Thank you. Good afternoon. My name is Violeta Gomez Uribe. I'm a community relations specialist at Metro Plus. Fun fact, 30 years ago when I came to this country, I was a patient here at Bellevue for over 10 years. So, my mother has received cancer treatment throughout the system, so I'm very thankful for the system, and I acknowledge how good the system has been to my family personally, but also to all the New Yorkers that they serve. Metro Plus is fully owned by Health and Hospitals. We serve over 700 New Yorkers, mainly working class New Yorkers and New Yorkers with lower resources. We are very proud of our partnership. We want to thank you for the partnership. We support community organizations as well as hospital events. We mainly want to thank, sorry, I have to take out my notes so I don't forget anybody. Gwendoline Robinson, Director of Ambulatory Care Service at Harlem Hospital. We also want to thank Philip Koch, Associate Executive Director of Intergovernment Communications and Community Harlem Hospitals. If anybody wants to keep partnering with us, have any questions, please contact me. I'm sitting over there, but you can probably find me in the system of Health and Hospitals since I've been a patient for a really long time. Thank you.
Thank you.
Thank you very much. Next speaker is Tashana King, Associate Medical Records Specialist at Bellevue. Tashana King. Okay. The speaker after that is Taiwan Kim, Senior Coordinator at the Korean Community Services of Metropolitan New York. And after that is Kent Mark.
Hello, good evening. My name is Taewon, and I'm from KCS, which is the Korean Community Services of Metropolitan. I'm a New York State of Health insurance navigator, and I'm also working alongside as a coordinator for NYC Care. We're extremely proud and happy and grateful to be a proud partner of New York City Health and Hospitals, receiving the grant NYC Care from September 1st, 2020, with our scope of providers being in Queens. Our job here as coordinators is to help the uninsured and underserved New Yorkers access healthcare by enrolling them into NYC Care and specifically emergency Medicaid as well. And being enrolled in these programs, we hear many grateful stories from our local community and that individuals are able to receive affordable and life-saving care. One of the stories that I want to share to you guys today is that one of the consumers that I helped enrolled into this program was able to receive care immediately after having a heart attack. And this was maybe like 1 month after being enrolled into the program. And that same family member also received a checkup and was also diagnosed with cancer. The medical team initiated treatments such as chemotherapy, and the family was successfully able to survive and receive treatment without any financial constraints. We're extremely proud that we're able to provide these assistance and support to the necessary community, and we'll continue to work to strive for our main goal, to help the uninsured and underserved New Yorkers to have access to healthcare. Our achievements in KCS for the last 18 months of contracted grant is as follows. We've successfully enrolled and case managed over 3,200 patients and had outreached 33,000 community members. And we look forward to our newly renewed NYC Care Grant, and we are really grateful to have this grant and that our scope of providers are expanded to Queens and Manhattan now. So thank you.
Thanks very much. Next speaker is Kent Mark, private citizen, and after that, Judy Wessler.
Thank you. My comments are directed to all the board members, to everybody sitting on the dais, and to the people in the audience who provide the services, particularly at Bellevue, but also Metropolitan and the other facilities. I'm really appreciative of the fact that the public hospitals exist, and we can tell from the prior comments that were made here, there are many, many people that are appreciative of this system. I'm both a patient here, and I'm also a former CAB member for about 3.5 years in the second decade of this century. And I like to give something back because I am thankful, as I said, and I like to do that through advocacy for both others and for myself. Now, sometimes that doesn't necessarily set too well with some people, but that's the way I choose to do it. And I think I do provide a service by doing that. I'm also all about education and moving this operation forward on a positive note. Now, while I'm cognizant of other closings in the area, as was mentioned earlier, and the burdens that are then put on this hospital and other public hospitals and other facilities, that's certainly not a small matter. But I don't see how that can be used as an excuse or a reason to greet in people properly or to speak to patients improperly on an administrative level. So while I'm clearly not complaining, if you will, about the level of medical services here, I am complaining about how matters are handled administratively. And I'm going to give a few examples of that. So I think that we need to look beyond the periphery, and we need to look at the greeting that people receive when they get here. So I was led to speak here because of a series of ongoing problems with the way I've been treated. And I can solve a lot of these problems myself, but the hospital in essence tells me that they want me to tell them about it because there are a chance for coaching sessions, a chance for classes, etc. But we've been doing coaching sessions and classes forever here. They were doing that 10 years ago when I was on the CAB. I participated in those training sessions, particularly with the pharmacy. And in a lot of ways, things have improved as to the way people talk to people and the way they treat people here. And I think that tells an entire story of the system and how it measures up administratively. Now, I put a lot of thought into this. I spoke to a lot of people in the hospital because I know a lot of people after coming here for about 15 years, and a lot of people that work here, and there's a lot of people that work here that are disappointed in what's going on here and the way people deal with people. Now, I don't want this to be a drink from a fire hose. I'm just trying to give some information that, hopefully somebody will grab a hold of and do. I'm all about solving problems from within, but I'm also about, if people can't solve the problems from within, going wherever I have to go to get those problems solved. So what I'm thinking about is a conversation that I had the other day when I wasn't getting the services delivered in an appropriate manner. And the party said to me, well, Mr. Mark, what do you want? I mean, just look at the world. The world is falling apart. Look at the way people talk to each other when you go to the store, et cetera, et cetera. And I said to this party, well, how can this be an excuse for doing this at Bellevue? I mean, now granted, everybody isn't like that, but I've heard those kind of comments more than once. So I've also had discussions with people about this is a bigger societal problem than it is an organizational problem. Well, it's still an organizational problem because it's happening to the patients when they arrive here. So I would like my letter that I wrote to the hospital in some detail, a multi-page letter on 2/26 of this year, to be included in this as a matter that it's included just along with what I'm saying here. So I'm going to give you an overview. Here's some examples of what I consider to be egregious conduct, which is an opportunity to fix this system. Some people talking about me forgot I was sitting around the corner. He's an old guy. He's too old to learn anything. You know, old people, you know, they're stupid and they don't know. And so he's so stupid as not to wear a mask. Let him die. Who cares? Now, when I approached that party that said that, they said to me, first of all, their mouth dropped open because they didn't know I had heard them. And then they said to me, well, it's okay. We have a right to free speech and you shouldn't listen to what other people say. I think this is disgusting, frankly, disgusting. Other people have told me the trouble with you is you want to change things and we like things just the way they work now. And we don't want to change anything. I've been here 25 years and I like the way it works. Well, I don't like the way it works. So in any case, I was told by an AOD not so long ago, we don't need your side of the story. I already got the side of the administration, so we don't have to hear what you have to say. Well, I mean, I would want to hear this on the premises, not have me broadcast this somewhere else. So, and nothing I'm saying should be taken as a threat. I don't provide threats. I provide good faith notice. And hopefully people act in a positive manner on good faith notice. So the other day I was told just last Thursday, so we wasted your time again in trying to get services, but we only wasted an hour and a half of your time, and that's okay. Many different things here. There is nothing to investigate. They've assigned somebody to investigate in the administration. I appreciate that, but I don't see that that's going to go where it needs to go based on what I'm being told. Now,
Sir, would you conclude your remarks, your 5 minutes? Or
sure. Okay.
Thank you.
So what I would like to do here is I would like people to understand what I'm talking about. And, you know, let's get beyond this plausible deniability, this willful ignorance. Let's get down to getting this job done that needs to be done here in dealing with people in a proper, respectful manner.
Thank
And
you so
let me
much.
make,
We can take your written comments. That's fine. That is fine.
Right.
Absolutely.
Thank you. Thank you.
Thank you for your comments. Next speaker is Judy Wessler, private citizen, many other things. And after that is Mariano Laboy.
Hi,
Hi, Judy.
friends, Barbara, Jackie, Mitch, too, I guess, yeah. So I am a board member of the Commission on the Public Health System, and what I can talk about is the work I've been doing with CPHS. Finally, after probably a year of negotiation, and thanks, Mitch, for interceding, I believe, we have agreed on language. CPHS got funding from the City Council last year to prepare a manual on understanding the healthcare system. We did not have, and still at this point don't yet, but will hopefully soon, have a director. So 3 of the board members, including myself, have been doing the policy work, and with 2 fantastic medical students. Neither of them go to NYU, because who would go there? I'm sorry, I'm being sarcastic. I'll get to that. Did this manual on understanding the healthcare system. And there was 1 paragraph in 45 pages that was offensive. And so we've been negotiating that, and thanks to Deb Brown as well. We have now hopefully, although I haven't gotten official agreement, agreed on that language. The importance of what I'm saying is, well, there's a lot of important things about it, but at least one thing is that part of preparing the manual, CPHS had worked with the community advisory boards for 25, 30 years, has not been, and hopefully that can be rectified. And we had planned and hoped to do educational sessions with community-based organizations and the CABs and the CAB members about understanding the healthcare system. Clearly, the offensive paragraph stopped that, or maybe something else did. I don't know. But hopefully, with that gone off the table, we can get beyond it. The importance of it, I was just talking to the vice chair of the Bellevue CAB about it, is the manual has been updated, and it now has quite a bit of information which is not publicly available in other places on the state's new 1115 Medicaid waiver demonstration called New York Health Equity Reform. And the state of New York has not talked about equity, and they now have it in the title of a Medicaid demonstration, and money will be coming in. Hopefully we can use it to really do some work on equity for a change. Not that H&H doesn't already do that, but there are many parts of the system that don't. So there is quite a bit of information, and we would want to do it, and hopefully there'll be a new director of CPHS, and so I will do some of it, but the director will be doing educational sessions. Most people have no idea that this has happened and this is happening, and that NIHER will be rolled out, and that community-based organizations will be playing a major part, and that a lot of Medicaid now can be used for what I used to call the activities that of daily living, and now the fancy title is the social determinants of health. And as a new way of reaching out more into the Medicaid population and doing work. And H&H has been moving in that direction with some of the contracts. Congratulations on that. I wish there was more of an emphasis and a highlighting of the ambulatory care facilities. You know, the hospitals get all the glory and the glamour, and the ambulatory care facilities do huge amounts of important work and should get more of that. So anyway, that's what I wanted to come and say. I also wanted to say that H&H and the city should stop pouring so much money into NYU Langone, which has a reputation of good medical care, but what most people don't know, they don't take care of a lot of people. They don't take Medicaid patients. They sure don't take the uninsured. And they claim, you know, they have Bellevue. So a lot of money goes to this institution that's not doing what it should be doing, and it had over $600 million. I know you're going to stop
Yes,
me, Andy,
if
but
you
I
would,
will
please
finish-
conclude your
I
remarks.
will finish what I
Please
have to
conclude
say.
your remarks.
You know you're
Of
not
course,
going
we'll
to
take it
stop
in
me,
writing.
right? So anyway, they have $600 million of what is called excess revenue. We call it profits, okay? Whereas Bellevue and all the other public facilities need that kind of money, and yet they're still getting public funds from places like the Indigent Care Pool. So there's a lot of policy work. I'm not going to stop until I'm finished.
Thank you. Okay. Well, we can take anything that you have in writing, but it's only fair to the other speakers to have, it's only fair for all the other speakers to have the same amount of time. Don't mean to insult. Thank you very much. Next speaker is Mariano Laboy, And after that is Tisha Elena McCoy.
People that Judy is an icon in our community. It's come to my memory that going back to the late 1990s, the year 2000, she used to go to our meeting and give a good speech in regard to this. Greeting everyone with Dr. Cass, board members. My name is Mariano Lavoy. Different, I'm from the Bronx, but it's my duty to be here today. In the past, I came to this board praising and decision on occasion for your assistance in regard to Morrisania and your delivery, Dr. Cass, your delivery, but not today. And this is my grievance. Helen Hospital Board directed decision to build a housing complex, Morrisania parking lot, and to give half of Morrisania Clinic was a wrong decision. The board member never took into consideration what the community need. Your decision is categorically wrong. You never consider how many programs employees are going to be deposed, where the staff are going to be parked, what effect they will have in our community. And to that, on March 6, 2020, the developers, SPD and Helen Hospital representative gave a PowerPoint presentation to the CAD member. There were many questions with no sense answers. When I began questioning the representative, there were no answer at all about parking, the effects, the pool, how many square feet they're going to take from Morrisania, what effect that will have. There were no answer. The following day, on March 7, Mr. O'Kenfie Liberty and Ayman Musani called me and explained to me that the developer Helen Hospital representative were complaining about regard to the meeting that took place on March the 6th. The complaint were that I was very unprofessional, I was rudeness, and the one that hurt me the most, that this man stated that Mariano Lavoy made derogatory remark about blacks. I categorically denied those accusations. During the months of March and April, Mr. O'Kenfie requested for me to write a letter to the people to apologizing. I rejected. Furthermore, the following day, during the month of March, I sent an email to Karen Dixon explaining what took place, and we met alongside Mr. Liberty, the council of Camille Dixon, and they began to lecture me about how to conduct the meeting. They didn't forget that I was the chairperson of the Council of CAB going back to the year 1990s and 2000. And Mr. O'Kenfie, Liberty, and Charlie Dixon, and the Council of CAB Vice Chair, shame on you. Shame on you. As a community resident of Morrisania, I will always fight unto my last drop for the betterment of our country, our community. Henla Hospital board member, your shameful decision to build a residential complex in the parking lot was categorically wrong. As a board member, I will continue fighting for the betterment of our community. Ladies and gentlemen, at least 3 times a week, I go to Morrisania to see what's going on. This morning, I went over there. This is the van rating. There are some people. They say we're going to lose provider due to the commute and parking. The morale is very low. Dental, we have to wait 12 months. Eye doctor, we have to wait 18 months. It happened to me. I went in November. My next appointment is in June 21st. Dr. Cass, board members, you have been very supportive in the past. And our request from Morrisania, but not this time. You hurting our community. It hurt me to see my community going down the drain. Please, next time you make a decision, consult with the community. I want to thank you, Dr. Cass. I remember in the past, before pandemic, we went to you in the Bronx, and you delivered with gusto. We are very proud. But don't know this time. But to the board member, my apologies if I say anything wrong. But let me tell you this. this decision to build a new complex in Morrisania. Absolutely wrong. Thank you very much, and we'll continue fighting because we're going to be advocating and lobbying for you for the funding that you may need. Please continue doing the great job on this particular one. I disagree with you. Thank you very much. Have a good one.
Thank you.
Thank you. Thanks for your comments. Next speaker is Taisha Elena McCoy, Metropolitan Cab member, and after that is Karen Dixon.
Hi, good evening. I'm stepping in for our chairman, William Smith, in his absence. I would like to thank New York City Health and Hospitals and the Board of Directors for your strong support of Metropolitan Hospital, being the community hospital of choice for residents of East Harlem who rely on its services. I would like to acknowledge Ms. Christina Contreras, our Chief Executive Officer, and her staff for all the hard work throughout the year. We are grateful to have such dedicated leadership at the hospital and to have a great partnership with the CAB and the hospital administration. Metropolitan is true community hospital. We have generations of patients and their families who have come to rely on Metropolitan for their health care. Our mission of ensuring that the medically underserved have access to high quality care, regardless of their immigration status or ability to pay, is at the core of everything we do for our patients. Metropolitan strives not only to achieve excellent outcomes for our patients, but to provide meaningful services that promote the health for our overall community and reduce longstanding inequities. As a result, Metropolitan is recognized as a leader in healthcare and for its commitment to our community. This is evident by the fact that our hospital was once again at the top of the list of racially inclusive hospitals in the United States. Metropolitan was recognized as America's most inclusive hospital for serving all patients in its community by Lone Institute Hospital Index for Social Responsibility. It achieved this honor out of 3,533 hospitals nationwide graded by Lone. This is Metropolitan's second time as #1 in the nation for inclusivity. It earned that spot in 2021 as well for the third year in a row. Our hospital is also #1 in New York State in health equity, inclusivity, and race inclusivity categories. This is a great testament to how well we serve our community. Metropolitan also continue to be nationally recognized for providing high quality clinical care and services. Some over the past year include Metropolitan has redesigned as a baby-friendly hospital. This designation awarded by Baby Friendly USA is an initiative of the World Health Organization and the United Nations Children's Fund, UNICEF. Metropolitan received 2 American Heart Association Get With the Guidelines and Mission Lifetime Achievement Awards, Stroke Gold Plus Award, Target Diabetes Honor Roll, and Heart Failure and Silver Award, Target Diabetes Honor Roll. Metropolitan's NICU received Golden Beacon Award for Excellence from the American Association of Critical Nurses, the only NICU in New York City to secure this esteemed designation. Metropolitan was recognized with a National Safe Sleep Hospital Certification Program as a Gold Safe Sleep Hospital for its commitment to best practices and education on infant safe sleep. Diabetes is a major health issue in our community. Metropolitan earned CDC full recognition for our diabetes prevention program. This designation is reserved for programs that have effectively developed a quality, evidence-based program that meets all the standards for the CDC recognition. Metropolitan has been designated as a leader in LGBTQ healthcare equality for 6 consecutive years. We recently opened a comprehensive Pride Health Center, a dedicated space to provide care for the LGBTQ community, and Metropolitan is one of the only few public hospitals in the country that offers gender-affirming surgery, recently reaching a milestone performing the 200 procedure. In terms of our growth, although we are a small community hospital, we have experienced significant growth over the last year. as we are always looking to enhance our services or created new programs in response to community need. Metropolitan has been designated as the system's official acute rehab center. This is a great use of Metropolitan as a center for excellence for rehab, helping to decompress other facilities by moving their rehab patients to Metropolitan. Metropolitan began performing minimally invasive robotic surgery in the areas of gynecology, urology, bariatric, and general surgery with its newly acquired Da Vinci X surgical system. How many minutes I have left?
Your time's just expired.
Okay.
Can you conclude?
Yes.
Okay.
Thank you. Metropolitan began offering this bariatric surgery and is developing a plastic surgery program in response to the community's needs. Thank you very much.
Thank you very much. Thank you. And if there's anything additional you want to submit, we will happily take it. Thank you. Okay, our last speaker for the evening is Karen Dixon. She is the chair of the Council of Community Advisory Boards, or CABs. Karen Dixon.
Good evening. So as chair, I'm going to yield 2 minutes of my time to one of my CAB chairs that didn't make the list. Is that okay?
It's okay.
Okay.
I
Go
appreciate
ahead.
it. Thank you, Karen. I will be very brief and I appreciate your time. I've had some family emergencies, so I was not able to sign up. So thank you. First of all, I am the chair of the Community Advisory Board for Gouverneur. I have a long history with Gouverneur. Years ago, I went to 3 different healthcare providers trying to figure out what was wrong with me. I walked into the clinic at Gouverneur. A nurse took 5 minutes, examined me, and told me, and unofficially, of course, that I had cancer. She was right. She was the only one who could figure it out. She told me where to go and she told me how to take care of myself. She put me on the right path. And ever since then, my experiences at Gouverneur have been with innovators and educators. And this is what we have in health and hospitals. I would love to see health and hospitals highlight and support these innovators, like Jaime Inclán at Roberto Clemente, who is trying his best to put together a new system to educate behavioral health care providers, to bring them into our system and educate them on patient care, new innovative processes, and to help deliver better quality behavioral care in a time where it's sorely needed in our country and in our city. The other education that I would love to see, and Judy spoke to this earlier, this is something that I do in my personal business. I do insurance and billing. I cannot tell you how sad it is when a patient comes to me and says, "But you told me it was covered." Yeah, it was covered by your insurance. They don't understand that they have out of pocket, that they have deductibles. And I know that Metro Plus does an excellent job in explaining insurance to the patients. When I go into health and hospitals, people ask me, "Where's the people at Metro Plus? Why aren't they there? I'm here to see them. I have a question." They're terrific. We need a formal educational system to teach our patients about financial health and how to navigate their expenses. Thank you.
Thanks very much.
Good evening, Dr. Katz, members of the Board of Directors. My name is Karen Dixon. I am a licensed Masters of Social Work. I also run a nonprofit, but I am the proud chair of New York City Health and Hospital Harlem CAB, as well as the chair of the Council of CABs. I'm here this evening to just give brief remarks about our beloved facility. I'm going to be honest, I'm going to brag on the work of our facility. I am also an immigrant, came to this country undocumented, raised by my family here. And so many of who Health and Hospital serves, I can reflect back in the mirror because they reflect me and my family. Harlem Hospital, let's talk about their accomplishments. Why I have a lengthy list, the one list accomplishment that I thought I would list first was the fact that 100% of our internal medicine residents passed the boards. And one of them has the second highest score in the entire United States. Yeah. And so when you talk about the caliber of staff that are at Health and Hospital, and specifically at Harlem, and I'm not trying to throw shade on any other facility, but I'm here to rep my facility, we are most proud of that. But there are other accomplishments that we've done over the year. We also had 2 doctors that were part of the top 2024 top Black doctors list for medical expertise, Dr. Joan Culpepper Morgan and Dr. Wendy Wilcox. So we're also proud of that. We just keep showing up in all of these spaces. Our burn intensive care unit received a silver level Beacon Award for Excellence from the American Association of Critical Care Nurses. And we understand that it's the first and only in New York City, the second in New York State, and one of 4 in the United States to earn that silver rating. We are a baby-friendly hospital. If you ask anybody in the community, what is Harlem Hospital famous for? It's famous for those babies. And so we're glad to have that designation again and to have that certification done. Over a year ago, our CEO informed us that we were going to be getting robotics to do robotic surgery. And here we are a year later, and we've performed over 340 surgeries. We need another robotic arm. Because we want to do that. We understand that is one of the safest ways. It reduces the risk of infection. It's a much faster recovery process. And so we really want that to be supported. And in our advocacy efforts through our Legislative Advocacy Day, as well as our legislative, I just saw the light, sorry, as well as through my apologies, as well as through our legislative luncheon, both city and state representatives were there to support what we are going to want to do at Harlem Hospital. I do want to thank Dr. Katz, but I also want to thank our CEO, Mr. George LeConte, because he has created an environment, Mr. LeConte, he is, as well as the leadership team at Harlem Hospital, because they engaged our community advisory board and they always keep us involved in public facing activities and events to further merge the relationship between the community and that they serve, as well as the hospital. Thank you so very much and have a good evening.
Thank you. Thank you. So that concludes our program for the evening. No more speakers. Thanks so much for those of you who spoke, and travel safe. Thanks.